NHS?
Our NHS!
Whose NHS?
Our NHS!
I'm just walking up to the hospital now, and if we're going to keep our community health services public, get out away from private profit, then we've got to make our voices heard right now.
We're here today because we are trying to encourage NHS Gloucestershire to make the right decision and keep our hospitals in the NHS, in the public sector, owned by us and accountable to us. We've been told that they can do this now as a result of our campaigning, but they're yet to say that they will do this.
I'm here today because I believe that the National Health Service does not belong to any government, it belongs to the people of this country, you and I. I do not see through privatisation how a few people's wealth can be far more important than the nation's health. Do we want to end up like the USA with 20% of their country without any insurance cover whatsoever? About another 150 million were on basic and the rest are wealthy enough not to really care. Is that the sort of system we want here? Well, I don't think so.
We face a severe threat to our NHS right at this very moment. The vultures from the private sector are circling and swooping onto our NHS right now. Virgin through Assura Care are taking over services, and we have to recognise the threat to our NHS and respond to it and build a movement that can push back the privateers and get the money off of those big businesses who don't pay their taxes, get the money from the 370 billion that is stashed in private bank accounts of the businesses as well to pay for our NHS. That's what we need. Now, we've had a certain success in Stroud and in Gloucestershire. We've managed to push back management's plans. Management were planning a year ago to transfer 3,000 staff and 9 community hospitals, including Stroud Hospital, into a community interest company or social enterprise. We have managed to scupper those plans through campaigning and through a legal case that we launched as well. Now, the position we're in now is that at last management have accepted that NHS options are on the table. For a year they've denied this is possible. Well, through Freedom of Information, it was exposed that they knew about it long before and that they were talking about it, but weren't publicly saying it. But we knew that it was possible. We knew around the country, in other areas, that's exactly what they'd done. So
yes, I'm part of Keep Our NHS Public from Oxfordshire, and I've come to support the Stroud fight because what a lot of people don't know is in America 62% of all personal bankruptcies are caused because of medical costs. So, you know, we need to keep this. We have got a gem here and we ought to fight for it.
And now we have to pressurise management, because although they put it in words that a standalone trust can be formed and that services do not have to be tendered, we know they don't have to be tendered out to the private sector, but on paper it's one thing. We have to now force management to make sure it's genuinely kept as the NHS, and that's what this protest is about. Really, we had the previous government open the door to the private sector into our NHS, and I'd say this government are kicking the door down. The Health and Social Care Act is about dismantling the NHS.
We're here on behalf of the Labour Party, the people of Stroud, to ensure that services stay within the NHS.
He says, "What an amazing campaign. Please pass on my admiration and best wishes to all involved. This has been inspirational. Good luck and truly well done. In solidarity, Mark."
Well, I'm here because I feel very passionately about the NHS. We've got to keep it private. We must not let people like Virgin get.
Got to keep it private.
Yes.
All right.
Oh, sorry. Got to keep it public.
We'll edit that bit.
We've got to keep it public. We can't let people like Virgin get their hands on it, because then we're lost.
And I say, no thank you, Mr. Branson, actually. I don't see why our health service should go to put money in his pocket. In Churchill Medical Practice in Kingston, they've just got rid of 48 patients because their treatment was too expensive. They were highly vulnerable patients, and that was what a report showed. It was for financial reasons.
Yeah, I'd like to say why I'm here, so that when my children and my grandchildren need treatment and need services, they can go and get them, and that there's an equality of service and fairness across the entire country. And I don't want to see it taken off into little bits and little pockets of of excellence, and and then those people who can't afford it, haven't got the resources, are left with a second-rate service.
Why are you here?
No, we're just doing the same as what Mum said.
This campaign is actually pinnacles of resistance to what's going on in the health service at the moment. So many times you could hear people being scared off, arrogant managers in the health service trying to tell people there was no other option than the plans that they had. It is heartening. I am proud and I am fortunate to be associated with the fight back, where the people of this country who use the health service are saying, no, we will not have our NHS made into a profit-making company. It's our NHS.
The NHS is still, we've still got to carry on fighting for it, and but positive moves have been made, but now we've got to finish the job off really and hope that we can keep all our services in the NHS where they belong.
As already mentioned, this health service belongs to us. No government, previous, present or future, has a right to steal it from us. Working people in the 1930s and 40s worked very, very hard to make sure we had a health service. Now, I never get up and speak, but I feel very, very passionate about the health service. Do not look for leadership, become leaders yourself. Stand shoulder to shoulder and fight, as Nye Bevan said. So for your health's sake, join Stroud and Gloucestershire against the cuts. You're all welcome. Thank you for listening.
And just lastly to say that yesterday what was also announced was because of the campaign they finally had the staff consultation that they never had before. They should have had a year ago. And they asked staff, they gave them 5 options from an NHS standalone trust, social enterprise, private companies, splitting it up into little pieces and merging with foundation trust. And 91% of staff said they wanted it to stay an NHS standalone trust.
Because I only live 100 yards from here. It's my ward that I represented for the last 26 years, and I still see that NHS sign and I think we really intend to keep that way. I mean, I don't think I've ever met anyone in this town who actually wants to change out of the NHS. I think we should realise what our power is and use it. Thank you very much.
Well, because the NHS still remains one of the most important issues that we have in terms of political difficulties at the moment. Although, we're being, if you like, crowded out by all the issues to do with the euro and the economy, the fact is that our NHS is being privatised not so much by stealth but by very open attempts. Now, we've done some interesting things in Gloucestershire, and I hope the rest of the country can see that you can take the powers to be on, including the government, and win.
Why am I here? Well, I was a little bit confused about that, to be honest with you, because I'm not sure how much you can achieve at this level, but I was always a bit sceptical about the legal case, and in fact it turned out much better than I expected. So, I've asked James to remind me that it's worth resisting at every level and at all times, even if it's raining. So there I am.
Who's NHS? Who's NHS? NHS! Who's NHS? NHS!
Well, I'm quite disappointed that we're still having to fight this fight, really. After the judicial review, I think we thought we were nearly there, and now...
Our NHS! For sale! Our NHS! Not for sale! North, south, east and west, we all want the NHS!
I'm just here because I believe in the NHS as an expression of the public's desire and wish to have a public service, and I think it's important that we resist any pressure to try and hand services over to the private sector. That's why I'm here today.
Thank you, that's it.
I've had wonderful service from the NHS. I'm still getting wonderful service from the NHS, and it's very essential because I'm falling apart. And I really, really don't want to go and get the facilities from somebody in the private sector. It's that simple. It's not for profit.
South, east and west, we all want the NHS. North, south, east and west, we all want the NHS.
Well, we've got this one chance. I think it's a one chance now to make sure that we're heard, to make sure we're clearly heard,
One more person
and
to
be heard
grab
en
the
masse.
banner at the front.
If we can do it now, there's a better chance that it will be heard and acted on. If we wait, it could be too late.
We all want the NHS. North, south, east and west, we all want the NHS. West, we all want the NHS. North, south, east and west, we all want the NHS. We all want the NHS. Not another Eton mess.
You made that chant. Where did it come from?
She made it up for that march. Yeah, I didn't make it up before. The Eton mess thing. I had a picture of David Cameron with an Eton mess on his head. That's my banner.
This.
Yep, made it into a pithy rhyme for this particular march.
No.
Don't tell.
As Nye Bevins said, there'll always be a health service so long as there's somebody who's prepared to fight for it.
Thank everyone for coming today. I think we sent something in her. And put that in writing to her and make sure, particularly our elected representatives can do that as well, but we can, as individuals and as a campaign, do that. And that will be going from right across the county today, this message. So it's an important message.